So, which of the following diagnostic tests is most appropriate to confirm the suspected diagnosis? Karyotyping, measurement of VLCFAs in plasma, MRI, muscle biopsy, lumbar puncture. What's the diagnostic test? Okay. So, 7-year-old boy, he's brought to the pediatric clinic by his parents who report that their son has been experiencing progressive difficulty in walking, worsening school performance, and behavioral changes. Patient has a family history of the same symptoms in a male cousin. On exam, the patient exhibits mild spasticity, positive Babinski, and impaired hearing. Okay, so I'm trying to figure out what syndrome this is. So intellectual disability, difficulty walking. So same symptom in the male cousin, so maybe an X-linked disease. Um, and then the hearing loss. The hearing loss, I'm like, I'm honestly not sure what kind of disease that they have. Um, but I know it's an X-linked disease, or most likely an X-linked disease. Like some of the ones that I know, like that affects like walking and stuff is like spinal muscular atrophies, Duchenne's. Um, I
Okay, how
wouldn't
do you want
say
to confirm it?
cerebral palsy. I don't know. Like I wanted to say a muscle biopsy, but I'm not sure. But that's more for like polymyositis, dermatomyositis. And he has
Mm-hmm.
like a hearing too. So I'm like, okay, do I want to confirm with a brain MRI because of the impaired hearing, see if there's some sort of, I don't know, tumor or something that we can see that's affecting that. Maybe the difficulty in walking is due to vertigo instead of a muscular thing, but then it has spasticity and positive Babinski sign. Um, very long chain fatty acids in plasma. I feel like I've heard of something like that before. I'm not really too sure. I wouldn't do a lumbar puncture. I don't think I'll do karyotyping because I don't think it's X like stuff in karyotypes is like X linked or things like that. I don't know. I just want to say B, honestly, for some reason. Just a guess.
Okay, good. Yeah. So this is kind of interesting, right? And so this is going to be kind of your X-linked metabolism of kind of your very long chain fatty acids, which is why you get so many random stuff, right? Behavioral changes, muscular issues, hearing issues, right? All these kind of issues, right? But then the question is, if it's X-linked, why wouldn't you do karyotyping, right? So number and structure of chromosomes, right? But the thing is, it's not specific enough. You know what I'm trying to say? Like the question asks, what is the most appropriate to confirm the suspected diagnosis? So karyotyping can give you some kind of clue, but not all of the information. Brain MRI, right? But it's not specific, right? Muscle biopsy, like I said, it's not going to show that, right? It's going to be a neurologic issues with the long chain fatty acids, and the lumbar puncture CSF is not going to give you that very long chain fatty acid issues. But one of the key things here, one of the key takeaways I would say for this kind of question is kind of put this in your mind that at least how I remember, at least for diagnosis with biochemistry or metabolism, usually you have a hodgepodge of symptoms. What I mean by hodgepodge, it affects like a lot of symptoms that doesn't make sense. Like for instance, like when you say positive eventually time, myospasticity, right? Issues walking, you're thinking, oh, maybe it's a muscular dystrophy. But then when you add in impaired hearing, behavioral changes, things like that, you're like, wait, that doesn't make sense, right? And so you're adding too many systems that it doesn't fit in kind of your common diagnosis. So you got to start thinking, is it a metabolism issue or some kind of very like bad syndrome? You know what I'm trying to say?
Yeah.
So the like I said, brain MRI, right? Unless you're looking for a tumor, but that can only talk about, mainly talk about maybe hearing, right, or things like that. Muscle biopsy is mainly kind of a muscular dystrophy and things like that. Lumbar puncture, you're thinking about meningitis, or even certain kind of MS and stuff like that you can find, but not really fit the picture here. Karyotyping is too broad, unless you're looking for a trisomy or something like that. It's not going to give you specific diagnosis to confirm anything. So if you look at this, the most specific test, even if you're wrong in your diagnosis, is going to be B on a test taking standpoint. You know what I mean?
Yeah.
It's going to be the only one that can confirm anything, right? The rest is like you still need to do more tests. So